The first doctor said it was stress. The second said it was anxiety. The third said it would pass. So he went home. Still sick, still getting worse. But the tests were normal. The scans were clean. Nothing looked wrong, so nothing was done. Weeks passed, then months. He stopped trusting his body because every time he asked for help, he was told nothing was wrong. Until one night, his body stopped asking and collapsed, without warning, without explanation, on a hospital floor that should have protected him sooner. The question is not what was wrong with him. The question is, how many times was he quietly sent home to die? At first, nothing dramatic happened. No blood, no seizures, no collapse, just a feeling that something inside him was slowly breaking. He was 36, healthy on paper, no chronic disease, no genetic history. He exercised, he slept well, he had no reason to be sick, but his body disagreed. It started with dizziness, not spinning, not fainting, just drifting, as if the room was half a second behind reality. Then came the headaches, not sharp, heavy, like pressure building behind the eyes. Then the fatigue, the kind sleep cannot fix. He woke up tired. He went to bed exhausted, and every day his body felt less like his own. So he went to a doctor. The exam was quick, reflexes normal, blood pressure normal, heart normal. The doctor smiled. "You're under stress." He went home relieved for 3 days. Then it got worse. Another clinic, another white room, another calm voice. Anxiety can do strange things to the body. He nodded because the doctor sounded certain, but his body did not. The third doctor ordered tests, blood work, MRI, CT scan, everything modern medicine trusts. The results came back normal. Every number inside the acceptable range. Every image clean. No tumors. No bleeding. No infection. The doctor looked satisfied. Good news. Nothing serious is wrong. But he did not feel good. He felt invisible because something was happening, and the machines could not see it. Weeks passed, then months. The symptoms multiplied. Memory gaps, sudden confusion, words vanishing mid-sentence. He began writing reminders to himself, not for appointments, for basic tasks. Eat, call back, turn off the stove. He stopped making long-term plans because he no longer trusted how he would feel tomorrow. Doctors are trained to recognize patterns, but his symptoms did not form one. They drifted, they hid, they mimicked stress, they mimicked anxiety, they mimicked nothing specific, which made them dangerous. He began doubting himself. Maybe it was anxiety, maybe it was in his head. That is the quiet damage of dismissal. It teaches patients to distrust their own warning system. Inside his body, a process was advancing, not fast, not dramatic, just steady, invisible. The collapse did not happen in public. No crowd, no sirens. It happened at home, in the bathroom, while brushing his teeth. The room tilted, then disappeared. His body folded, not violently, quietly. This time, the numbers were not normal. Heart rate unstable, blood chemistry abnormal, brain activity irregular. Only after his body failed loudly enough. Further testing revealed the truth: a rare neurological autoimmune disorder, one that attacks slowly, subtly, before scans change, before blood tests react. Treatment finally began: steroids, immunotherapy, hospitalization. His condition stabilized, but not fully reversed. Some damage had already settled in. This case is not rare. It is simply rarely noticed because it leaves no early fingerprints, only patient testimony. The most dangerous diseases are not always the loudest. They blend in. They look normal until they no longer are. The question is, how many others are being quietly sent home right now, while their bodies are already beginning to fail?